Thank you for asking me the question. And it's really great to be here today with Research America, who's really helped to support research in the area of oral health and to increase the knowledge about oral health issues worldwide. And this is really important because tooth decay and periodontal diseases are the two biggest threats to oral health worldwide. And the CDC has looked at the prevalence of these diseases in the United States. For 2 to 19-year-olds, 46% of children have caries or have had caries, which is really a large number. And you hear of stories like Diamante Driver, where it's untreated and they can develop a brain abscess, and it can be a fatality, which is a shame. And you hear of stories of people in the OR requiring surgery because of untreated decay. And periodontal diseases are much more common in adults, especially as we get older. But, you know, almost 50% of the US population has some form of periodontal disease. And certainly we know that there are many links between periodontal diseases and other diseases in the body. And this is really driven by the inflammation that is caused during periodontal disease. So periodontal diseases are initiated by the bacteria that accumulate around the teeth. And your response to those bacteria is often the production of cytokines and enzymes that can cause the breakdown of the connective tissue and bone that supports the tooth. And this chronic inflammatory disease, which is unbeknownst to many people because it's not painful very often until the tooth is either loose or they develop an abscess much later in the disease, can really have a significant impact on the body. And it is the most common chronic inflammatory condition worldwide. And we've seen these connections between chronic inflammation in the oral cavity and other diseases like cardiovascular disease, diabetes, adverse pregnancy outcomes. And in fact, the bacteria that are found within the oral cavity have been found in atherosclerotic plaques, and they've been found in amniotic fluid. So when we think about periodontitis or gum disease, it increases the risk for fatal MI and stroke by almost 2 to 3-fold, which is very significant. And periodontal infection can account for up to 18.2% of adverse pregnancy outcomes, preterm low birth weight, as reported by the group at UNC. And the risk of developing diabetes over a 20-year period of time was looked at by the group at Columbia. And they found that people with periodontal diseases were twice as likely to develop diabetes. And for diabetes, it's very interesting because it's a two-way street in that not only are you at increased risk for developing diabetes if you have periodontal diseases, but if you have uncontrolled diabetes, you're at greater risk for developing periodontitis as well. And it's one of the long-term complications like cardiovascular disease or kidney disease. And we know that in people with diabetes with untreated periodontitis, their risk for having a heart attack or for developing kidney disease is much higher, and their risk for mortality is much higher. So anything that we can do to reduce the risk of these long-term complications is very important. So insurance companies have looked at this with the University of Pennsylvania and found that treating gum disease can lower annual medical costs in people with diabetes, with cardiovascular disease, with stroke victims, up to $6,000 a year, and can reduce hospital admissions up to 40%. So the Surgeon General took this on 20 years ago and wrote the first report on oral health in America. And that was Dr. David Satcher. And he recognized there are a lot of oral health disparities that need to be addressed. And our current Surgeon General, Dr. Jerome Adams, is doing a 20-year follow-up on that report, recognizing that we've made some progress, but there's a lot of work to do. And there's a need for increased prevention. There's research that's needed for early detection and diagnosis, because as I said, many people don't know that they have it. And we need to continue to do our work on improved management of oral diseases to improve the quality of life for US citizens and citizens all over the world. And this will lead to better general health and well-being.